A statement signed by the Director of Information and Public Relations, Ben Bemgung, states that the ministry remains committed to collaborating with all stakeholders to ensure a swift and effective response. Staying on health matters now, this time in the nation's capital, the Malaria Consortium is advocating for a sustainable way to domestically fund preventive tools for the elimination of malaria in Nigeria. This formed part of discussions at a meeting to reel out updates on the malaria response in the country. TVC News' Kemi Balogun reports.
Nigeria still accounts for the highest malaria burden in the world, gulping up an entire 55% of all the malaria cases and 31% of estimated deaths in the West African region. This is according to the 2022 World Malaria Report. Experts here say the disease still requires the effective mobilization of resources to end the burden through the designing of innovative tools in order to fast-track its elimination.
What we will be seeing is that in that same base, different populations are targeted. We see that there's been an integration of more than one intervention. You have areas where there are bed nets being distributed, but there is chemo prevention also going on, there is case management, and I'm sure that with the coming of the vaccines, once this is added into the portfolio, you will see dramatic drops in mortality.
We also know that the way the epidemiology of malaria, the trajectory of it has changed over, let me say, 10 years. We have moved from majority of the states or locations within the country being largely high prevalence of malaria to situations where we still have pockets of high prevalence, but we have also some locations in which the prevalence is very low, in which case such situations are now requiring different mixture or different types of strategies for us to be able to fast track the elimination of malaria.
Last year, about 27 million children were targeted and reached with the seasonal malaria chemo prevention drugs across 21 states and the FCT.
It has been proven that if we continue with SMC, more than 80% of malaria cases will be reduced among children 3 months to 59 months, because that's the age group target in Nigeria.
Malaria Consortium says an increase in donor funding through both government and private sector financing is one way to achieve the elimination of malaria in Nigeria. Kemi Balogun, TVC News, Abuja.